A very good morning to our beloved lecturer, Dr. Yu. Today, our group has chosen liver biopsy to be done into tissue processing. My group members consist of myself as KASHMEETA, RENISHA, Darshni, as well as KAUSALYA. So this is our case study. Fika is a 33-year-old working woman. She is a heavy alcoholic drinker. She's been having some symptoms such as fatigue, loss of appetite, and losing weight. She ignored those symptoms due to hot weather and humidity. One day, while she was doing her daily workout at the gym, she was feeling nauseous and fainted. Her friend rushed her to the hospital, and the doctor requested for her to do a liver biopsy. So first step of tissue processing is specimen logging. Specimen logging is a process in which the patient's details are filled in order for the lab to have a record on the number of patients and specimens that are obtained. This process is done as well as to make sure that the patient matches with the description to the one mentioned by the doctor. It is also done to make sure they got the correct specimen from the correct patient and to make sure the information matches to the one on the specimen container. So the one on my left is the specimen logging form, while the one on my right is the specimen container. The patient's details, name, specimen that is taken, age, specimen ID, date collected, date sheet, receiving lab, date received by the lab, and comments is done in the specimen logging form. While on the specimen container, the date, room number, name of patient, and the doctor is written on it. Thank you. That's all from me.
So for the second step is dissection of liver sample by a percutaneous biopsy, whereby an incision is made to insert needle to go through the abdomen and into the liver. Sample of liver is then extracted. And then the sample is grossed and cut into small pieces to fit the plastic cassette. The cassette is then placed in fixative to fix tissue and prevent degradation.
Now let's look into step 3, which is tissue processing. There are 4 main steps in tissue processing, which are dehydration, clearing, infiltration, and impregnation. In dehydration, the liver specimen is passed through in a series of alcohol with a gradually increasing concentration. The purpose of dehydration is to remove water and fixative from the tissue. The second step is the clearing step, which the main purpose of clearing is to remove alcohol from the tissue. The clearing agent used in this case is xylene. This will allow the paraffin to penetrate into the tissue even more better. Third is infiltration. In infiltration, the xylene is removed from the tissue through diffusion. And last step is impregnation, where the tissue is saturated by wax. The common wax used is paraffin wax. This is the image of automatic tissue processor, where the liver specimen is passed through 70%, 95%, and twice in 100% alcohol, and also twice in xylene for clearing step. And this is the drawer of paraffin thermal unit, where the liver sample is immersed into the molten paraffin at 55 degrees Celsius. Step 4 is embedding process. This is the final stage of tissue processing. This will provide support to the specimen, allowing it to form into a tissue block, which can later be made into thin sections for sectioning. There are 4 common embedding media used. They are paraffin, plastic, carbowax, and celloidine. This is paraffin dispenser unit, where the tissue is made into paraffin blocks. Now let's look a little bit on paraffin embedding. Usually paraffin embedding are solid at room temperature. The hardness of the paraffin should be same as the hardness of the tissue. The paraffin is melted for about 2 to 3 hours in paraffin oven before pouring into the tissue. Once the tissues are dehydrated, the tissue will be embedded in paraffin. So that's all from me.
As for step 5, the step is called sectioning. Sectioning is basically cutting a paraffin embedded and frozen tissue into a very thin slice. So the main instrument used for sectioning is microtome. Sectioning is basically a way of technique of making a very, very thin slice of tissue specimens using microtome for the examination to identify the abnormalities in the tissues as well. As for the procedure of sectioning, it's very easy. The tissue surface must be pared off at 15 to 25 micrometer to expose the tissue face before taking sections. And the square uncut block must be placed into the microtome. Once the microtome is on, the microtome must be operated until complete sections are cut. Once cutting, the sections will be floated in water and the fishing process will be taken place. As for the fishing process, is that the slides will be kept in a water bath at 60 degrees Celsius. And at last, the slide will be placed to evaporate all excess of water. The most common troubleshooting of this process is that the ribbons become curved because of the neglection before the section cutting that the back and the razor are perfectly parallel to each other. This may cause not having a straight ribbon. Other than that, failure of cleaning the water bath may affect the slides where artifacts to lay on top of the tissue as well. As for the step 6, the step is called staining process. Staining process used to improve contrast in sample tissues. As it is difficult to identify the cells in the tissue, staining process are introduced where it differentiates each component of the cell, which allows clearer observation of the tissue. So the most common staining is hematoxylin and also eosin. Hematoxylin dyes the nuclear and the eosin dyes the cytoplasm. Hematoxylin usually appears in a purple color, eosin usually appears in a pink or sometimes in red color as well. For the procedure of staining, the slides will be immersed in alcohol and washed with tap water several times. The slide will be immersed in hematoxylin and tap water to change the color of the components, and the process of removing water from the slide by immersing it in alcohol and xylene for a few minutes. And the last, the mounting and staining, where the cover slip will be added after adding mounting area and let it to dry. The first step, slides will be immersed in alcohol, is called hydration process, and the second will be staining process, and the third will be dehydration process, where you remove all the water, and the last will be mounting process. And the most common troubleshooting of this process is that sometimes the stains will be too light and formation of bubbles and also breakage of the tissues. Very important to know and do the procedures as well to avoid all this light stain formation of bubbles and breakage of the tissue in the end of the examination.
Step 7 is microscope slide viewing, whereby microscope slide is closely examined after staining. The specimen has ranges of purple color, which is light and dark shades because of hematoxylin and eosin stain. The slide is also labeled on its frosted end, whereby accession number, slide designated number, type of staining used to stain specimen, and patient's name is stated. In the last step, slide is viewed under light microscope and 3 different magnifications are viewed, which is 10 times, 40 times, and 100 times magnification. Fibrosis and inflammation in tissue sample can be observed, indicating cirrhosis in patient. The micrograph observed under the microscope were good micrographs. Bad micrographs has wrinkle sections due to blunt knife, appearance of knife lines due to nicks in blade, folded tissue sections due to curled section, and empty spots in sections due to captured bubbles during embedding process. Thank you.